Hi, my name is Lisa, and I am the founder of Rest Ministries. We are a Christian organization that serves people who live with chronic illness or pain. I have had rheumatoid arthritis since 1993, so about 16, 17 years now. And this last fall, I decided to have joint replacements in my left hand because my hand was becoming so malformed. A lot of people don't have to have these kind of surgeries now because of the wonderful new class of drugs like Enbrel, Humira, Remicade, that kind of thing. But those did not exist until I had had my disease for about 10 years, and some deformities had occurred. And then last year, because of a bad infection, I had to spend about a year off of those medications, so the deformities in my hand continued to grow. I thought I would go ahead and share a little bit about joint replacements in the hand, just because when I was looking for this information online, it was very hard to find. And there wasn't anything from a real patient's perspective, just a lot of generalities about asking your physician or your physical therapist or anything. So I'm doing just a short series of videos on what I went through, and basically just kind of showing you the different splints that you will be wearing. Of course, for every person is different, and for every physical therapist and surgeon has their own way of doing things, but it'll give you a general idea other than trying to look up some stuff in the medical books that I did. First of all, just to kind of show you, this was pretty much what my left hand looked like. It was going towards the outside quite a bit. My two fingers, my ring finger, my little finger, pretty much were disconnected from the rest of my hand. They would kind of just get caught on things like the wall or the door as I was walking by things. So the brain functioning as far as telling them what to do was getting less and less. And then as you can see here, my index finger and middle finger were also starting to go that direction. I didn't have much of a grasp at all. I couldn't really hold a cup of coffee any longer. I couldn't get wet clothes out of the laundry, which some people would say is a blessing, but all those little things that add up to basically forming your life, I was losing the function of. And my right hand is quite malformed already as well. I've got quite a bit of tendon ruptures in there. So between the two hands, becoming malformed together, I didn't have as much use as I wanted. This is an x-ray of the summer of 2008, and you can see there a little bit about how those bones are starting to go out. And then by 2009, a year after the being off of Humira, it was quite more dramatic even than that. It actually in some ways made me feel good to actually see an x-ray and see that the pain I was going through or the difficulties I was having weren't all in my head, that they really did exist. So basically I had surgery on November 4th with a surgeon here in Encinitas that's done my hand surgeries before, and he replaced these four knuckles, and as you can see, I am now out of the splint, but I've gotten them back out to show you. And if you watch this series of videos, you'll see the latest splint that I'm in about 12 weeks after surgery. So the first day I had surgery, I had these four knuckles replaced. And basically it's a plastic joint made out of silicone that's kind of a ball, and then it has two spikes. And what they do is they go in and take your joint out, shave off the ends of your bones, and put those spikes in holes that they drill into your actual bones, and then put that joint in there. It's quite amazing what they can do, really. So I had that done, was home within just a few hours. They, of course, when you have surgery, want you up and out of there. I was barely able to move. I was kind of out of it, and my husband half carried me out and pushed the wheelchair and got me there. I couldn't quite stand, and they were still getting me out of there, getting me home before the medication for pain wore off, is what they said. I did take Percocet, and that's what I was prescribed, and I really wanted to stay on top of the pain. In the past with rheumatoid arthritis, whenever I've had any kind of surgery or trauma to my body, I've gone into a horrible flare, especially in my shoulders when there's anything going on with your hand. My shoulders are kind of disintegrating as well, so to have any kind of extra burden or cast and weight on my arm was bad. So I took Percocet that first week, really about every 4 to 6 hours to stay on top of the pain, and then tapered off within a few weeks, where I was just taking it at night and quit completely. So I would recommend talking to your physician about how you plan to control pain, and if there is any way that you can stay on top of the pain before a flare occurs, that will definitely be to your benefit. I have to say, even though I'm older and surgeries are getting more difficult as life goes on, this was probably the best scenario I could have had. So I'm very grateful for that. And I came out of surgery with a large ACE bandage wrapped around, lots and lots of bandages, and only my fingertips showing for that first week. And then I went back and saw the surgeon. He replaced it, and then within 8 days I was at the physical therapist. I did actually see the physical therapist before surgery to my because my surgeon requested that, and she doesn't always do that. But I would say that if you are having any kind of hand reconstruction or something major, it is helpful for the therapist to actually see what your natural form was beforehand. So when they go to give you the exercises, they can tell you what you should and shouldn't be doing as far as what your natural instinct of your hand was to do, and they wanted to do the opposite of that. So since mine were going towards the outside, they want to make sure all of my exercises push the fingers back towards the inside, towards my thumb. So that was helpful. It also gave me an idea, at least just kind of an idea it may entail there. Of course, you never really know until you go through it, but it was helpful for that. So I'm going to stop now and move on to this video.
If you'd like to see what the splints actually look like and my experience with that.